My name's Stephen Gordon, and I'm the General Secretary of the European Central Council of Homeopaths, which is the council that recommends homeopaths who are not medical doctors in Europe. And we have some 27 associations in 25 countries throughout Europe, and I'm the sort of coordinating General Secretary for the internal work, and I also represent the council in Brussels, where we're engaged in lobbying for complementary medicine and homeopathy, things like access to medicines, that sort of thing.
So what brings you to Barcelona, which is a research conference?
Well, every so often an event appears on the horizon which you think this is a nodal event. There's something special about it, and to me this event is particularly special. I think that this had a sense about the timing, the fact that it's bringing together basic research, clinical research, provings, and also importantly that it's bringing together the two communities of homeopaths, the medical homeopaths and the homeopaths who are formed primarily as homeopaths, and that we can each see that each of us is striving for best research in homeopathy.
And clearly that goes across all aspects of our profession. So why do you think people should really care about research at this time?
Well, I think research is a fundamental prerequisite of any science, and homeopathy to me has always been primarily a science on which we base an art. So, and it's been a mystery ever since Hahnemann wrote the organons to how our medicines work. But he got it dead right. He got it dead right, but in his language of his day.
Yes.
And now we're elaborating that in modern scientific terms and in modern scientific methodology. So I think it's important that we as a homeopaths know that, apart from the fact that we wish also to allow others outside our community to understand how homeopathic medicines work and how effective they can be.
What do you think are the challenges you see, or the imperatives you see for homeopathy research?
Well, I think it goes back to the previous question in a way, in the sense that I do think we have to elaborate how our medicines work, as much as for the outside world as for ourselves, and also to show that they do work, because there are emerging crises right around the world. I mean, for one example, antimicrobial resistance is a huge crisis, and they do not, the conventional medical people, WHO, the European Union, do not know what to do with it, and they have announced this as a major crisis. There are no new antibiotics coming through the pharmaceutical system. And my experience as a practitioner, because I've practiced homeopathy for 30 years, and my observation and my looking at the research data that already exists, is that homeopathy has a primary role to play in treating people with treating infectious disease, thereby taking the pressure off antibiotics, which I think are a necessary form of medicine, but they've been so overused and abused that we've got to take the pressure off them, and homeopathy offers a wonderful way in to treat vast numbers of people with infectious diseases and therefore not have to use antibiotics. So that's, to me, one of the major reasons why we really have to get our message out there.
And included in that message is obviously cost, the cost of public health systems as well.
Absolutely. Well, that's right. I mean, the cost is astronomical, because not only do you have you get the secondary costs now with antimicrobial resistance, for example, and then because there's a whole thing of adverse reactions to drugs, which add secondary and tertiary costs to healthcare, which health systems have to pick up. So if someone who's got an MRSA infection from a hospital, for example, that costs the system to treat on top of the primary costs. So if we can offer some assistance, and I'm not claiming for 1 minute homeopathy is going to offer all the answers to this, but it's definitely got huge potential to help deal with this emerging crisis to do with antimicrobial resistance, and in a very cheap manner, because we don't need to do the research for new medicines that the pharmaceutical industry is under pressure to do. Our medicines exist, they have done for the last 200 years, and those same medicines will treat people who've got infectious diseases.